Okay, we're a little bit past the hour here, so we'll go ahead and get started. I want to welcome everybody. My name is David Pacer. I'm one of the partners here at InfiniTALKS, and I'm going to be the moderator to open up the presentation today. I think you're going to find the information extremely helpful and useful. But before we jump into this, just a couple housekeeping things. The presentation should be around 45 minutes, and we are going to open it up to questions at the end. What we have found is many of the questions that most of you are going to have should be addressed throughout the presentation. That's why we want to wait till the end so we don't interrupt the presentation. But we will open it up to questions. Just a reminder for those that are on the call that don't know us, InfiniTALKS. We're here in Overland Park, Kansas. We're a large financial services firm, and we do specialize in investment planning, but we also are a full service firm. So in addition to retirement planning and investment planning and estate planning, we often find that people have questions about tax planning. So we are a full coordinated firm, and we do these InfiniTALKS pretty much every month. And we have a great speaker for you today, so I'm pretty excited to introduce Grant. Grant George has been doing this for over 5 years. He is a senior advisor with Medicare Done Professionally, and he specializes both in Medicare planning and under age 65 ACA health insurance. He joined the firm back in 2020, and he helps folks both locally here and across the country, both individually and virtually. So he's going to walk through some of the basics of Medicare. Medicare planning, that includes Part A, B, C, and D. And then, different timelines on when you need to enroll, how to choose between the different supplemental and advantage plans. So at the end, it really doesn't matter if you're approaching age 65 or supporting someone who is. This session is really meant to educate you and to give you some clear, unbiased education and guidance to help you make some informed decisions. So like I said, it's going to last about 45 minutes. We will open it up to questions, but I know that you're going to find the information very useful and very informative. So with that, Grant, I'm going to turn things over to you. Thanks for presenting today.
All right, wonderful. Well, thank you so much, David, and thank you so much, everybody, for being here today, and for the InfiniTALKS team for allowing me to present today to all of you. Today, what we're going to be doing is taking a deep dive on Medicare, of course. So we're going to share with you a presentation that we've developed here at Medicare Done Professionally, and we call it the A, B, C, and Ds of Medicare. So our objective, of course, is to better help you understand Medicare in its entirety, the four major pieces, A, B, C, and D. And we're going to try and put it best we can from a consumer's point of view. So with that, we'll jump right in. So what is Medicare? Medicare is our federal health program. Majority of folks are going to be 65 or older that are on the program, but you don't have to be 65. You can qualify for Medicare under the age of 65 if you've been qualified as disabled, fully disabled, and you're disabled for 2 years or 24 months. At the end of that 24-month period, you can get on to Medicare, and you automatically will be eligible for Medicare. And then any type of terminal illness, a big one's end-stage renal disease, Lou Gehrig's disease, or kidney failure, can also qualify you for Medicare under the age of 65. Now, Medicare was signed into law 60 years ago, back on July 30th, 1965, under Lyndon Johnson. And so the running joke is that, Medicare is not even old enough to be on its own program. But nonetheless, what was signed into law was original Medicare, which consists of Part A and Part B. So who runs Medicare? This is really just good to know. The governing body's CMS, which is an acronym, and you're going to find Medicare, and our government loves their acronyms today. CMS stands for Centers for Medicare and Medicaid Services. So they, of course, they operate Medicare. They operate the state-based Medicaid program. And then they also have heavy oversight on the Affordable Care Act. That's the under 65 marketplace. We're going to talk a little bit about the Social Security Administration, not exactly into depth about, when you can take Social Security and what that looks like, but more so how you enroll in Medicare, and that's through the Social Security Administration. So this is just a fun slide, kind of putting in perspective what's going on in the Medicare world today. So this gal right here, this is Kathleen Kirschling, and her claim to fame is that she was born a second after midnight, January 1st, 1946, kicking off that nearly 20-year span where about 80 million people were born, better known as the baby boomer generation. So of course, she was the first one to file for Social Security and Medicare benefits. But really what I like to share with this screen is not so much Kathleen Kirschling, but just kind of what's going on today, right? So those 80 million babies, the baby boomers, what I like to say is the biggest wave, the biggest tsunami of that generation is turning 65 today. And it's going to continue at that capacity through the end of the decade, through 2030. So what that means is that right now, any given day, there's nearly 11,000 people turning 65. And on a really good day, there could be as much as 14,000 people turning 65 right here in the United States. So that's really incredible, right? Medicare, of course, has their hands full. More people than ever are needing help trying to understand this maze that we call Medicare. And so that's what we're going to do today. And then another fun fact, there's currently about 68.8 or nearly 69 million people on Medicare right now. And by 2030, of course, it's going to be around 80 million people. So certainly Medicare has their hands full, and more people than ever are needing help trying to better understand this program. So diving right in now, the four major pieces of Medicare. So the four major pieces, hence the name of this presentation, Part A, Part B, Part C, and Part D. So original Medicare and Medicare itself started out with just two pieces, Part A and Part B, which is hospital coverage under Part A and doctor coverage or medical insurance under Part B. We're going to take a deep dive on both of those parts here in just a moment. For about 30 years, those were really the only two pieces. Then in the late 90s, Part C, which is more commonly or maybe even better known as Medicare Advantage, came out and came to be in about 1997. Medicare Advantage plans, there's a lot of talk about these plans. We're going to take a deep dive on Medicare Advantage plans, some of the pros, some of the cons, some of the things that are really, really advantageous, and some of the things maybe you should really consider before you pick an Advantage plan. These are private insurance, network-based plans, and we're going to take a deep dive here in just a little bit on Part C Advantage plans as well. And then the final piece is Part D. Part D is called Medicare Prescription Drug Coverage, and really simply put, Part D is what covers you at the pharmacy counter when you pick up any medications. So let's break down each of those parts. So original Medicare, signed into law 60 years ago, consisted of two parts, Part A and Part B. Part A is called hospital insurance, and really that's what it is. It's inpatient services. So when you go into a hospital, you are admitted in the hospital, you're laying in the bed, you have a room there. Part A is what's covering the cost that comes along with that. Part A is also going to cover skilled nursing and rehabilitation care in an inpatient setting. And then the last two legs of Part A is home health care and hospice care. Now, Part B of original Medicare is called medical insurance, but I like to call it your doctor's insurance because Part B is everything outside of the hospital. So think about primary care doctor visits, routine wellness exams, specialist doctors, cardiologists, neurologists, any doctor ending in ologist, I like to say, considered a specialist. Any type of imaging, x-rays, CT scans, MRIs, blood work and lab work. Durable medical equipment is a big one covered under Part B. CPAP machines, diabetic testing supplies, wheelchairs, walkers, oxygen tanks, lots of different things covered under durable medical equipment. If you're ever, in an outpatient setting getting any type of surgery, Part B is going to cover that. And then expensive medications that you have to go to the doctor or facility to have them help you administer that medication, like chemotherapy or radiation, an injection or an infusion. Part B is also going to cover that. So you can really see Part B of original Medicare is kind of the bulk of your everyday, every year coverage, because hopefully we're not in the hospital as often. So Medicare does cover preventative services, which of course comes from the Part B medical insurance. Here's about 26, 27 different items. that are all covered at 100%. Not going to read through all of these, but some of the major ones are your annual wellness visit, bone mass measurements, colonoscopies, well woman exams. Then some of your vaccinations, COVID vaccine, shingles vaccine, any of your vaccinations are going to be covered at 100%. So there's a couple things that original Medicare Part A hospital and Part B medical or doctor's coverage does not cover. One of the things we get asked about is long-term care. Grant, if I go into a long-term care facility, is Medicare going to help pay for that $15,000 a month cost that comes along with it? Unfortunately, no, it's not. That's where long-term care insurance plays a big role. So Medicare does not pay for room and board at a long-term care facility, but it will cover some doctor services and things that you may need while you're there. Routine dental, routine vision, routine hearing is also not covered, right? So twice a year teeth cleaning and you need a crown, Medicare is not going to cover that. That's where dental insurance comes in. Vision insurance, a routine vision exam, you go to the ophthalmologist, they give you a vision exam and then you pick out a pair of glasses and you get a nice discount on those glasses. Medicare is not going to cover that either. Now, if you have a medical condition of the eye, like you have diabetes that affects your eyesight, you have glaucoma, cataracts, macular degeneration. Well, those are a medical condition of the eye, and then Medicare would help pay, of course, for a vision exam with a medical condition of the eye. But if your eyes are doing good, you're just making sure you don't need any further evaluation, Medicare is not going to cover that. And then, of course, hearing. You need a hearing exam. Medicare wouldn't help you cover that or hearing aids. But again, like Meniere's disease is a medically diagnosed hearing loss. If you have something like that occurring with your ears, Medicare will help cover a hearing exam. And then finally, cosmetic surgery. Medicare is not going to cover anything cosmetic, and I don't know really any insurance that will. So Medicare Part A, the hospital insurance, that actually comes at no further cost. You've paid a lot of money into the Medicare system over your life. So Medicare doesn't come, Part A doesn't come at any further cost. However, the bulk of your insurance, the medical coverage or Part B, that does have a monthly premium. So Medicare's been around for about 60 years. And for about 45 of those 60 years, everybody paid the same amount when they went on to Medicare. Then the Affordable Care Act was signed into law about 15 years ago. And with the Affordable Care Act, they lumped in a law called IRMAA, another acronym. You can see it at the top of the screen, IRMAA. This stands for Income-Related Medicare Adjustment Amount. So since the Affordable Care Act and since IRMAA was signed into law, today, when you go on to Medicare, you do not, or you may not pay the same amount as your brother, your sister, your neighbor. It's all based on your household income today. And so really what that means is the higher your income, well, then Medicare is going to turn around and say, well, hey, you can pay more to be on Medicare because you can afford it. We can agree or disagree with that. But that's essentially, how can we get more money coming into the trust fund? That was a big portion of IRMAA. And so today, when you go on to Medicare, Medicare is actually going to base your Part B premium on your financial means. So with this chart, this is the most current IRMAA chart for Part B. If you go on to Medicare in 2025, what Medicare always does is they go back, they talk to their best friend, the IRS, and they go back 2 years and they pull your tax return from 2023, given that you go on to Medicare in 2025. Now, again, if you're going on to Medicare in 2026, they're going to do the same thing, and they're going to go to the IRS and pull your 2024 tax return. Then you find out on this chart, if you're looking and trying to find where you're at, you find out first if you're an individual filer or a joint filer. Individual's on the left side, joint is in the middle. Then, to the best of your knowledge, you think about where your income was 2 years ago, find your bracket, and then you go to the very far right, and that's what your Medicare Part B premium is every single month. And if you have a spouse in the household, they will also pay that every single month for Medicare Part B. As your income goes up, so does your monthly Medicare premium. This chart gets evaluated and changed every year. So we will see a new chart for 2026. It'll read very similar. But in 2020, at the top, it'll say for 2026, we're going to pull your 2024 tax return. The $185 at the very top, that is where most Americans fall, meaning they make less than 106 individually or 212,000 jointly. That's $185 on the dot today. January 1st, that's going up to $206.50. That information is hot off the press. So you'll see this chart gets adjusted and the premiums, unfortunately, like everything in this world, go up. Last year, it was $174. The year before that was $164.90. So it's gone up about $10 the last couple of years. It's going up about 20, right? $21 next year. So this is how your Part B premium is based when you join Medicare. So Medicare Part A and Part B, very, very comprehensive coverage for you at the hospital and at the doctor, but it only covers 80% of the bill. You're going to be left with the other 20%, and there is no limit to that 20% exposure. That's how Medicare has always worked for the last 60 years. You know, all things relative, that was a huge exposure 60 years ago, and still today in 2025, that is scary, right? We don't want to go into the hospital, be in there for a few days. It's a $100,000 hospital stay and have you be on the hook for 20% or $20,000. We don't want that. So there's a couple options or a couple ways that you're going to have when you go on to Medicare to get coverage for that 20% exposure. The first option is option number one is you can add with original Medicare A and B, you can add an additional piece of insurance called a Medicare supplement, or also known as Medigap. You'll hear me refer to it as Medicare supplement, but you can, of course, call it either one. And really what the Medicare supplement plan is there to do is to help cover that 20% that Medicare A and B would otherwise leave you with. Today, there's really about 8 different supplement plans that are available to you. And Medicare has to make this really confusing. Not only do we have Medicare Part A and Part B, hospital and doctor insurance, we also have a Medicare supplement, Plan A and Plan B, right? How confusing is that? So there's 8 different supplement plans, A, B, D, G, K, L, M, and N. And then there's C and F, but those are only supplement plans C and F are only for folks that turned 65 before 2020. Everybody turning 65 after 2020 is not eligible for a Plan C or a Plan F. So of those middle 8 plans, I know there's a lot going on this slide here. I'm going to try and condense this down. Of those 8 different supplement plans, almost everybody chooses right there smack dab in the middle a Plan G, Medicare supplement. And really simply put, what a Plan G Medicare supplement is going to do is it's going to follow your Medicare Part A to any hospital in the country, and it's going to follow your Medicare Part B to just about any doctor. It's just about universally accepted. And instead of you owing 20%, with a Plan G, all you have to pay is a one-time yearly deductible of $257 before everything the rest of the year is covered at 100%. Again, that is $257, 257, and that is a yearly deductible, January to January. So I mentioned earlier, with just Part A and Part B at the hospital, $100,000 hospital stay, you'd owe 20% or $20,000. Well, that same hospital stay, if you had a Plan G with you, a supplement Plan G, you wouldn't owe $20,000, you'd owe $257. If you had some follow-up doctor visits later, couple weeks, couple months later, you wouldn't pay anything because you've already met your deductible for the year. So really simply put, that is exactly what a Plan G does. And just about everybody that decides to go with option number 1, original Medicare and a supplement, chooses a Plan G. Now, there is a second plan that a lot of people are starting to consider, which is a Plan N over there on the right side. A Plan N is very, very similar to a Plan G. It has a $257 yearly deductible, but it goes one step further. It also has copays. So even after you've met your $257 deductible, the Plan N is still going to require that you pay a $20 copay when you see a doctor and a $50 copay when you go to the emergency room, even after you've met your $257 deductible. And then there's another piece of Plan N that it does not cover. It's called the Medicare Part B excess charges, also more commonly known as surprise billing. If a doctor or a hospital feels like they've gone above and beyond to provide a service to you, they can go to Medicare and say, well, hey, we went above and beyond to provide this service to Jane Doe today, and we want to bill you 15% above what you would otherwise pay us. And Medicare can either approve or decline that. And if they approve it, then you're going to pay that 15% additional charge if you have a Plan N. If you had a Plan G, you'd never know it happened because it picks it right up. So with a Plan N, because of those additional out-of-pocket costs with the copays and the surprise billing that's not covered, which we're really not seeing the excess charges today. We're really, really infrequently seeing those. But because it doesn't cover it, you typically see a Plan N is about $30 to $40, maybe even $50 less per month in cost than a Plan G. And yes, I said $30 to $40 to $50 less per month than a Plan G. A Medicare supplement does have a monthly cost, which we'll talk a little bit more about here in just a moment. Now, with original Medicare A and B and a Medicare supplement, you do have coverage for those really expensive drugs like chemotherapy and radiation, injections or infusions at the hospital or doctor. But what you don't have coverage for is prescription medications that you pick up at the pharmacy. So when you go with option one, original Medicare and a supplement, we also have to pick up what's called a standalone prescription drug plan for you as well. And this is what's going to get you coverage for those blood pressure, cholesterol medications, thyroid medications. Maybe you're on a GLP-1, right? When you go pick it up at the pharmacy, a Part D drug plan is what's going to get you coverage when you go to the pharmacy. There's a lot of different plans. Some of the plans not only charge a monthly premium for you to be on the plan, but they also charge you copays when you go pick up the medication. Your copay could be as little as $0 if you're on a tier 1 medication, but there is a 5-tier formulary, tier 5 being a specialty, very expensive medication. So as your drug goes from tier 1 to 2 to 3 to 4 to 5, the higher your cost is or the higher your copay is when you go to the pharmacy. And, even just a general average, it's hard to say, but this is something that we can take a deep dive with you on and tell you exactly what you would pay for each individual medication that you'd be on. Now, if you're on a tier 3, a tier 4, or a tier 5 medication, the drug plan does have its own pharmacy deductible, which this year in 2025 is $590. I don't yet know what that's going up to next year, but that is going up. I believe it's around $605 or $610 next year. Okay, so that would be option number one, is to go with original Medicare A and B, a supplement, and a drug plan. Option two, you're going to have two options. Option two, or an alternative option, is to go with what's called Part C, which is more commonly known as Medicare Advantage. Again, these plans started in 1997. There's a lot of big advantages, and there's maybe some things to consider as disadvantages with these plans. There's a lot of conversation out there about a Medicare Part C Advantage plan. These are your private insurance option under the Medicare umbrella. These plans, I tend to say, they look, they feel, they operate just like the insurance you have at work today or you had through a previous employer, right? So these are going to be operated through a private insurance company like United Healthcare, Humana, Aetna, Cigna, in some parts of the country, Blue Cross, Blue Shield. These are going to be managed healthcare plans. So there's going to be a network attached to them, like you've seen before, like a PPO, an HMO, or even an EPO. We're seeing more of those networks come out today. These are managed care in the fact that there's going to be some pre-authorization and pre-approval before your doctor can run tests and procedures, very similar to like what you have today at work. These plans are kind of all-inclusive plans. They have hospital, doctor, and pharmacy benefits built into one single plan. And the big advantage is that you pay $0 monthly premium for these plans. Now, just because you pay $0 monthly premium for the plan itself doesn't mean that you don't pay anything. With these plans, anytime you go to the hospital or to the doctor, you have a copay. And those copays accumulate in a calendar year towards what's called a max out of pocket. So you're not going to pay copays forever and ever. Eventually, if you have enough health happenings in a year, a big enough medical happening, then you will hit your plan's max out of pocket, where they'll say, okay, you've spent your $3,000 or $4,000 in copays. We, the insurance company, are going to pay all your copays the rest of the year. That is very similar to how your insurance would work today. But there are some pros and cons to that when we're comparing it to option one, original Medicare in a supplement. The big benefit being you don't pay anything unless you use the plan. Now, these plans, unlike original Medicare, they do cover those additional benefits you'll see at the bottom, like dental, vision, hearing. So they will clean your teeth twice a year. They will cover crowns and root canals. They will cover an eye exam, and they'll give you money towards new glasses. This plan is going to cover a hearing exam and give you money towards hearing aids. There's a health club membership or a gym membership built in, silver sneakers or Renew Active. There's an additional non-prescription allowance called over-the-counter allowance. You find yourself at this local grocery store, the pharmacy, getting vitamins, aspirin, supplements, allergy medications, Band-Aids. It's going to give you money towards that. And then some plans will cover and deliver meals to your door after a hospital stay. And some plans, a lot are going away from this, but some will even take you to and from a doctor's office appointment. So like transportation services. So lots of advantages, but maybe some things to consider as disadvantages that we'll kind of pinpoint here in just a moment. Okay, so everything that we've just talked about up to this point, we've talked about original Medicare in a supplement, in a drug plan, or option one. And then we've talked about Part C Medicare Advantage, or option two. So when you start your Medicare journey, you're going to have two options of how you want to receive your healthcare benefits when you go on to Medicare. Option one is the left side of the chart, where the arrow is pointing left. Option two is the right side. So when you start your Medicare journey, you're at the crossroads up there. And before you actually begin, you have to decide, okay, do we want to be on the left side or the right side? Just a very quick recap. If you choose to go left, then your primary or foundation of insurance is going to be original Medicare, Part A and Part B. Very comprehensive coverage under the hospital, very comprehensive coverage at the doctor's office under Part B, but it only covers 80% of the bill. What we would help you do is we would help you add an additional piece of insurance called a Medicare supplement or Medigap policy, right? There's 8 different supplement plans. Almost everybody goes with what's called a Plan G. And what that Plan G, as in Great Plan or Gap Plan, will do is it's going to follow your original Medicare to the hospital. 100% of all hospitals in America take Part A. And it's going to follow you to the doctor's office. Just about 98% of all doctors in America take Part B. It's universal coverage. There's no HMO or PPO networks. And instead of you owing 20%, now with that Plan G in place, you just have a one-time $257 deductible, and then any other hospital or doctor visits the remainder of that year are covered at 100%. Now, Medicare A and B and that supplement do not cover you at the pharmacy, so we also have to add in what's called Part D prescription drug coverage. And that's going to get you coverage at the pharmacy. Now, if you remember earlier in our slide, we said that the left side of the chart does not cover routine dental, vision, and hearing. Well, Grant, how do we get coverage for that? That's very important to us. What we would do and what we can do is we would add an additional piece of insurance to cover your dental, vision, and hearing. And yes, that additional piece of insurance does come with an additional cost. So on the left side of the chart, you'd be paying for Part B based on your income, IRMA. You have a monthly premium in addition to that for your Medicare supplement. That is based on age, gender, and where you live. And then Part D, you could also pay a premium. Most of the drug plans do charge a premium under Part D. So there's 3 pieces of insurance there. Every piece has a monthly cost. And then if you wanted to add dental, vision, and hearing, that's going to cost you another $65 or so per person to get dental, vision, and hearing coverage, on top of that. So that is how we would get you coverage for dental, vision, and hearing on the left side of the chart. That is option number one. That is how Medicare worked for about 30 years. Then in 1997, the right side of the chart came to be. That is option number two, known as Part C or Medicare Advantage. The Medicare Advantage program is the private insurance option under Medicare. The big advantage here is that you have one single plan, covers hospital Part A, doctor's office Part B, and Part D prescription drug coverage into one single plan for zero monthly premium. Now, I do want to mention Medicare is still going to collect your income-based Part B, your IRMA, right? The 185, or maybe even a little higher if your income's higher, right? Medicare will still charge you that $185 for Part B, but that is all you would pay under a Medicare Advantage plan. There is no additional premium. You have the dental, the vision, the hearing built into the plan at no additional cost. You have the gym membership and all the over-the-counter allowances that come with that plan. Now, these plans are very advantageous for people that maybe don't use their health insurance as much because they aren't paying for the plan, and we only pay for an Advantage plan when we use it, right? We only pay co-pays for that Advantage plan as we go to the doctor or the hospital. So those can be very advantageous for the lower utilization folks that maybe don't use their healthcare as much. For the higher utilization folks, they might consider why an Advantage plan may not work as best for them because they're constantly paying copays, right? And the other thing is with an Advantage plan, it's network based. They have a PPO or an HMO, hospital and doctor network. So they have to make sure that the doctors they go to, the hospital is in network. Versus on the left side with Original Medicare, you have access to go wherever you want to go. And when they go to the hospital or doctor, the doctor is working with the insurance company and going through pre-authorization and pre-approval processes to make sure that what you and your doctor want to do, the insurance company also is on board with, right? And the insurance company may not see eye to eye with what your doctor wants to do. And they may say, well, doctor, we don't want you to go that direction. Let's try this path instead, right? And so that can cause for some issues with that managed healthcare model under the Advantage plan. So that can be taken as maybe somewhat of a disadvantage or just something to think about if you decide to go with an Advantage plan. One of the big questions I get is, well, Grant, I am pretty healthy, right? I'm 65, 66. I'm going on to Medicare and I really don't use my health insurance as much. So, I think I want to start with an Advantage plan. Because I probably won't use it a whole lot. So there's a lot of value there for me. But hey, 5, 10, 15 years, hopefully never. But if my health ever does take a turn and maybe I'm diagnosed with a pretty major medical disease or, a major medical condition, can I come back and see you? And at that point, 5, 10, 15 years down the road, can I switch over and go back to Original Medicare and get a supplement at that point? And the answer is probably not. Because here's why. You only have one shot or one chance to get a Medicare supplement, which is that dark blue box on the left side of the chart, number one. You only have one shot to get that at no questions asked, right? And that's right when you go on to Medicare, whether it be at 65 years old, or maybe you work beyond the age of 65 and now you're getting ready to retire at 67 and you're going to start your Medicare journey at 67. You would also have the ability to get a Medicare supplement at that point. But nonetheless, you only have one shot to get a Medicare supplement, no health questions asked, and that's right when you go on to Medicare. So what that means is if you decide to go with an Advantage plan, which there's many, many great plans offered, if you do go with an Advantage plan, you need to know that if you ever wanted to go try and get a supplement down the road, you are going to be subject to health questions. Now, it's just a series of questions. You don't need to go get a blood panel and go to the primary care and get a physical. It's just a series of questions with a little health history check. And the Medicare supplement's either going to do one of two things. Or one of three things, really. They're going to accept you. They're going to accept you and give you a rate increase because they don't like what they see. Or they're just going to say no, right? No, hey, you were just diagnosed with cancer. Or you had cancer a few years back. We're not ready to accept you. So we're just going to say no at this time. Right. And then at which point you keep your Advantage plan in place at that point. So That is one thing. That's one of the biggest complaints Medicare gets, is that I was never told if I went with an Advantage plan, I couldn't just readily switch and go get a supplement down the road. Now, we do have people answer health questions all the time that pass and that are approved and accepted to get a Medicare supplement. So it's not impossible. But when you want to switch over to that supplement, I would just say most of the time it's because you're probably experiencing a medical condition of some sort. And at that point, it can be very difficult. So very, very important piece to understand there. Now, when you start your Medicare journey, if you choose to go left, right, you can go get the Medicare supplement, no questions asked. And if you ever feel at any point you don't want that supplement anymore and you want to go over to an Advantage plan, well, guess what? It's quite the opposite. They'll welcome you with open arms to switch from the left side, option 1, over to the right side, a Medicare Advantage plan, no health questions asked. Even if you're terminally ill, you could still do that. You could switch from the left to the right, no health questions asked. So to conclude, what that means is it's very easy to go from the left side with original Medicare and a supplement over to the right with an Advantage plan. It can be very difficult to have an Advantage plan and go back over to the left because you have to answer health questions for that Medicare supplement. So here are your two options when you begin your Medicare journey. Option 1 is original Medicare and a supplement, and then we'd also add a drug plan and then ancillary dental and vision. Option number 2 is the right side, known as Part C or Medicare Advantage, all-encompassing private insurance, network-based plan, zero premium, that comes with all of the additional benefits like dental, vision, and hearing, and a gym membership at no cost to you. Two really, really great options, but distinctly different, right? One's an apple, one's an orange. Great taste, but distinctly different. And it's a big decision. We do not necessarily only work with one way or the other. We are happy to help you evaluate which way is best for you, left or right, and help you get going down that path, whichever works best for you. All right, so that is my favorite slide. That's kind of your flow chart to Medicare. That's everything that kind of wraps up what we've talked about so far. If you got a pretty good idea of what's going on here, you've got a really good idea of what Medicare looks like and what your options are going to be. So before you can take a left or a right, the first thing you have to do is you have to go out and you have to apply for Medicare Part A and Part B. That's the first thing you have to do before you can choose left and go with a supplement or right and go with an Advantage plan. So when can we actually do that? Well, the first time you can do it is during your IEP, initial enrollment period. This is a 7-month window that revolves around your 65th birthday. It starts 3 months before your 65th birthday, the month of, and then it's got a little 3-month parachute beyond your 65th birthday. That is your IEP, or your initial enrollment period. If you work beyond the age of 65, I tell you a lot of people do, and you say, nope, I don't need Medicare right now because I have employer health insurance, so I'm just going to stay with my employer plan. Or maybe we have a spouse that's younger than 65, so you wanted to keep them covered until they aged into Medicare, right? That's okay as long as it's credible employer coverage. Then down the road at 66, 67, maybe it's 70, now you're going to join Medicare. That's okay. Now you're just in a special enrollment period beyond the age of 65. You'll still be able to get on to Medicare. You'll still be able to go get a supplement or an Advantage plan, no questions asked. The key thing is that you have credible employer insurance the whole time since you've turned 65, which credible employer insurance means that that employer you work for has more than 20 employees. That's it. As long as your employer has more than 20 employees, you can stay on that employer plan as long as you're a full-time employee. Or if your spouse, right, is still working, you can stay on their plan beyond the age of 65 as long as they work for a credible employer. The only thing you're going to need to do as an additional step down the road in an SEP is that you're going to need that employer to complete a specific form called an L564. They're going to complete that and hand it back to you, and that shows and qualifies that you have had credible insurance since you turned 65, and that's going to negate any of those infamous late enrollment penalties, right? Well, granted, if I don't do anything at 65, I'm going to get a late enrollment penalty. My neighbor is just adamant that I'm going to get a penalty. Nope. As long as you have credible insurance and you get that form completed and you turn it in with your Medicare application, no penalties. So that's one of the big myths of Medicare. Once you're on Medicare, every year you do have the ability to change your plans. It's the AEP, annual enrollment period. It's every year, October 15th through December 7th. This does not mean anything to those people that are not on Medicare, but once you are fully on Medicare, this is very important to you. This is when you can change your plans if you want to. You don't have to, but you certainly can. This is a very busy time. This is when all the calls are coming in that you maybe already get. This is when all the advertisements on television are ramping up. You see a billboard pop up around town talking about Medicare. So this is a very busy time of year. And then they also have a new open enrollment for those folks that have Part C Medicare Advantage plans. They not only have this little 7-week period, they've got another 3-month period after the beginning of the year, January through March, to change their plan if they have a Medicare Advantage plan as well. Okay, so we know with Medicare, we have 2 options, original Medicare and a supplement. Option 1 or option 2 is an Advantage plan. We know that before we can select a supplement or an Advantage plan, we have to go enroll in Medicare A and B during our IEP or maybe an SEP if we've gone beyond the age of 65. But where do we actually do it at? Well, this is where the Social Security Administration plays a role. So where do you actually apply for Medicare A and B? It's through your Social Security or your My Social Security account online. If you haven't created a My Social Security account, I strongly advise you do. It's a wonderful little account. And you're going to need it at some point, right? Because you can't go access a Medicare application without going through your Social Security account. But this is exactly where you go. The website looks just a little bit like this, www.ssa.gov. You click sign up for Medicare right there in the middle. It'll take you to a login page where you log into your account, and then it'll take you right into the application where it's got most of your information already filled in because they've already got it. Your first name, your last name, your social, your date of birth. Then you just answer a few yes or no questions and you're on your way. The Medicare application is pretty easy for A and B, right? But it does take about 3 to 4 weeks to process. So you do not want to, come talk to me August 15th trying to get onto Medicare September 1st. Not going to happen. You want to start the process, whether it's turning 65 or maybe you've gone beyond the age of 65, right? You want to try and start that process 60 to 90 days in advance. Now, I know that, Grant, what if I get laid off unexpectedly? Those things happen, right? And we can help you work through that and we'll get you there. But if we can control our timeline, we want to start the process 60 to 90 days in advance, because the Medicare application can take 3 to 4 weeks to process. Once your Medicare application's processed, you get a nice red, white, and blue Medicare card with your name on it, your Medicare number, and it is paper, right? So it's not plastic. They don't spend a lot of money on this. But you get a nice red, white, and blue Medicare card with your name on it. Once you have this card, that is your green light. That's your golden ticket to decide if you want to get a Medicare supplement and a drug plan with original Medicare or replace it with a Part C Medicare Advantage plan through a private insurance company. Okay, so just finishing up here. And so just a few more slides here. So one of the questions everybody's asking themselves or asking their neighbors or their brother or sister that's on Medicare is, hey, I'm turning 65. Do I need to do anything? And everybody says, well, yes, you have to sign up for Medicare Part A or Part B. And the answer is maybe, right? You don't have to do anything with Medicare during your 65th birthday, excuse me. So when you're coming up on 65, you don't necessarily have to sign up for any part of Medicare, right? If you have access to credible health insurance or credible employer insurance, you don't need to do anything. You could just simply do nothing. Medicare is not going to have you send in a form telling them you don't want it. You just simply do not take any action. Now, one of the major reasons why, if somebody's going to continue to work beyond the age of 65, the only reason really I'd tell somebody not to go sign up for Part A, which doesn't cost anything, right? Why wouldn't we sign up for Part A if it doesn't cost anything? Well, really, it stems around if you contribute to a health savings account, right? If you contribute to a health savings account through that employer and you want to continue to contribute to that health savings account, you can't have Part A and contribute to that health savings account. So what I'd tell you to do is do nothing with Medicare, continue to fully fund that HSA, and then we'll go get your Part A and Part B down the road. If HSA or health savings account is a foreign term, you have no idea what I'm talking about, then I would tell you, yes, go sign up for Part A. It won't cost you anything. You'll get a Medicare card in the mail with your name on it. And it can make the process a little bit easier down the road when you fully retire, just to go get Part B at that point, as opposed to getting Part A and Part B down the road. Do I need Part B of Medicare? Well, remember, Part B of Medicare has a monthly premium. It could be $185. It could be as much as $700 a month if you're a really, really high income earner. So do we need Part B? Well, again, my question stems from, how do you have your health insurance now? Do you have health insurance through an employer? Are you still fully employed and working? If the answer is yes, and you work for a large employer, then then we just need to do an evaluation. How much is Medicare going to cost you versus how much is that employer plan costing you? And it may make sense to go on to Medicare and come off the employer plan, or it may make sense just to stay on the employer plan and go get Medicare down the road. Maybe you have a younger spouse, right, that you want to cover and get them to 65. Maybe you stay on the employer plan for that. There's a few different reasons why you may or may not sign up for Part B and go fully on to Medicare at the age of 65. Those are just specific to your situation. Other reasons, why you should sign up for Part B: if you're a veteran and you're going to the VA hospital and that's all you're relying on is the VA hospital, well, believe it or not, our federal government doesn't consider the VA hospital to be credible insurance. So if you're a veteran and you're going to the VA and you're saying, well, hey, I've got the VA, I don't need Medicare because the VA does everything. It takes care of me. It does everything I need it to do. Well, if you don't go sign up for Part B and pay your $185 a month premium, you will get a late enrollment penalty if you ever sign up for Medicare down the road, right? Maybe the VA can't do what you need it to do, so you need to go get on Medicare and go to an outside hospital, right? When you go sign up, you're going to get a penalty because of that. So if you're a veteran, you need to sign up for Part A and Part B if that's all the coverage you have. So just really important. Federal employees is another big one. Federal employees have insurance for life, right? So if you're a federal employee, FEHB, Federal Employee Health Benefits, you really have two options. You can take the federal employee plan and do nothing with Medicare, but you're in the same boat, right? If you do nothing with Medicare, if you ever decide you do want to go on to Medicare and maybe come off the Federal Employee Health Benefit plan, you're going to get a late penalty. So federal employees, if you're one of them, there's maybe a conversation to be had. If you think that maybe you're just going to stay on that plan instead of do Medicare, I think it's just a quick conversation we can have, some talking points maybe for you to consider as well. Okay, so beyond the age of 65, the L564, this just is your credible insurance form. When you work for a credible employer, they have to fill this form out. I talked briefly about it, but this will negate any late penalties for you. Last couple slides, just some additional resources. If you're coming up on 65, you probably got this book. If you haven't got it yet, don't worry, it's coming. I know you can't wait for it. It's about 185 to 200 page booklet that's coming to you. It's a wonderful piece of literature to read if you're trying to go to sleep at night. But all joking aside, if you do get this book, we say don't toss it. It's a lot of money spent to publish this, and there are some good talking points in this book. So some of you may already have it. Medicare.gov. So www.medicare.gov is your resource for the general public for all things Medicare. So we just like to mention that, www.medicare.gov. You can go out here and find all the information I just talked about. I don't think it's as nicely worded, but nonetheless, all the information I talked about, we jokingly say we don't make this stuff up, right? It's all published right here on Medicare.gov. So it's a great resource for you as well. Okay, and that is our presentation today. Again, my name's Grant George. I'm a senior Medicare advisor here at Medicare Done Professionally. We are based in Kansas City, just right down the road from the InfiniTALKS office. We are local to Kansas City. We would love to invite you into the office and come talk to us if you have any questions. If you're not in the Kansas City area, please feel free to shoot me an email, give me a call. We can meet virtually via Zoom and kind of discuss your situation. We're in about 32 states around the country as it stands today. So we do have the ability to support those folks that are outside of the Kansas City area. We do not charge any fees to meet with us and for our services. And so just mention that as well. So with that, I will let the folks at InfiniTALKS and Lauren and David maybe open it up for some questions.
Okay, great. Thank you, Grant. Appreciate the presentation. Lauren on our team is kind of running the technology today, so she's going to open up the portal so you can unmute your microphone and ask any questions you want for Grant. And hopefully everybody should be able to hear the answers.
For this presentation, I found it quite helpful. I'm actually on this journey for my mother as the enrollment period approaches upon us. My question is around the difference within plans. I think there was one slide on the left side, you had the supplemental insurance with Medicare, and then on the right side, you had the Medicare Advantage plan. My question here is, if she currently has the Medicare with the supplemental insurance, what's the difference between switching that, like from that current situation to the Medicare Advantage plan and then going back again in a year later? I guess I'm trying to understand, what are the benefits of the Medicare Advantage plan over the other? I saw on the bottom right there some indications of like gym membership or other. There was an OTC allowance. I was just trying to understand, like, what are the difference there?
Okay, perfect. And so I think you said currently you're going through this with your mother, and did you say she currently has a Medicare supplement plan?
That's correct. She has it with United.
Okay, so with what she has right now, with original Medicare A and B in a supplement, she has, in my opinion, just about as good a healthcare as you can get in America, right? She has access to go to any hospital in the country. She has access to go to just about any doctor. About 98% of all physicians in America take Part B. And with that Medicare supplement with her, right, she's just got a one-time $257 deductible. And then any other hospital or doctor visits are covered at 100% the rest of the year, right? So she has basically universal coverage to go to any doctor or hospital in the country. And furthermore, she doesn't have any of the managed healthcare models or practices, right? When she goes to the doctor and doctor says, here's what we're going to do and here's the approach we're going to take, they can go ahead and do it, right? They aren't going to get questioned. They're not going to pre-authorize or pre-approve any of those services, tests, or procedures. They're just going to be able to do what they need and want to do. And short of a $257 deductible, right, she's covered at 100%. So it's very easy to use. It's very hassle-free coverage. And she has universal coverage wherever she wants to go. Maybe a downside is that, up front, the cost might be, of course, a little higher, and it doesn't come with things like dental and vision and hearing, right? Some supplements do have a little dental discount program and maybe a basic vision, but nothing like, going to the dentist and getting your teeth cleaned and covering a crown or root canal, right? So she would have to pay extra for those types of services under original Medicare. So that might be one of the downsides, if you will. But the big advantage of what she has, or the big pro, is that she's got wonderful, wonderful health insurance to go to any hospital or doctor in the country. Now, the alternative option to what she has would be the Medicare Advantage plan. The Advantage plan is a private insurance-based plan. United Healthcare, for example, offers her supplement. They also would offer a Medicare Advantage plan. The major difference with an Advantage plan is that it's network-based, right? She doesn't have access to 100% of all hospitals in the country and 98% of all doctors. She's going to have to go to a doctor and a hospital and a facility within the United Healthcare network, which is a big, broad, expansive network, but it's certainly not 100% or universal coverage. Furthermore, with an Advantage plan, when she goes to the hospital or doctor, United Healthcare is going to work side by side with that doctor and make sure that that doctor takes the approach that United Healthcare wants to take, right? If United Healthcare says, well, doctor, I think that's a little unnecessary for you to run an MRI, the doctor might not get it approved and may not be able to do it. So there's a lot more managed healthcare under the Advantage plan, which is really no different than any private insurance plan out there. But when you're comparing it to what she has in original Medicare and a supplement, it's vastly different. And that's maybe something to consider. One of the big advantages of the Advantage plan is that it does come with dental, right? So she doesn't have to pay extra to get dental. It'll come with that. It'll clean her teeth twice a year. It comes with vision. It'll allow her to get an eye exam and give her money towards glasses and hearing. It does have a gym membership. So her local community center, maybe one of the gyms in town, like Lifetime Fitness or a Genesis Club or a Planet Fitness, she could go there with no cost, covered under that gym membership. And if she ever buys vitamins or aspirins, supplements, allergy medications, also known as over-the-counter items at the pharmacy, she'll have an allowance to go purchase those items, which is a big, big advantage. Now, lastly, the big advantage is that currently she's paying for a Medicare supplement through United Healthcare, right? So she pays every month for that Medicare supplement in a monthly premium, which could be $180, $200 a month or so. With an Advantage plan, she wouldn't pay any additional monthly premium. She would only have co-pays to pay as she used and if she used that Advantage plan, right? So $20 at a doctor's office, $40 to $50 for an urgent care, $100 to $150 for an emergency room, $300 to $400 a day to be in the hospital. So the big advantage is that if she doesn't use her health insurance as much, she could theoretically save the cost of what she's paying for that supplement and only pay as she needed it with that Advantage plan, which is a big advantage for some folks out there that maybe don't use their health plan as much. And then they just kind of reap the benefits of all the additional dental, vision, hearing, gym membership, over-the-counter allowance. But if she ever, for example, wanted to change to an Advantage plan, it could be very difficult if she said, well, gosh, yeah, I really don't like this Advantage plan. I don't like how it works. I really liked what I had before. If she did that and moved over to an Advantage plan, it could be very difficult for her to come back and get a supplement down the road, because now, since she left that supplement, she'd have to answer health questions and medically qualify to get it back.
Understood. Hence your earlier point where, right, when you sign up for Medicare, if you have the supplement, then that's your window of opportunity, if you will.
Correct.
Okay, perfect. This is very helpful. Thank you so much. I appreciate it.
Wonderful. You bet.
This is Larry Greenbaum. I had a question about the premium that for a supplement. Is that going to be based entirely on the 2 years prior to applying, or will that change from year to year?
Okay, great question. So 2 years, so the piece of insurance here that's based on your income from 2 years prior is Part B, as in boy, the medical insurance. So that is based on your income from 2 years prior, and that will get reevaluated every year, right? So if you join Medicare in 2025, they're going to look back at 2023's income. Then as we roll into 2026, they're going to reevaluate that. They're going to send you a brand new letter in the mail that says, hey, welcome to 2026. We talked with the IRS. We pulled your 2024 income, and for this year, this is what we're going to charge you. For 27, they're going to look back at this year, 2025. And every single year, they'll do a 2-year look back. So for some folks, they may always be in that base premium level. Some folks start out at the lowest level, and then maybe they did a Roth conversion, and 2 years down the road, their income spiked, so their premium does. Maybe they sold a property. So essentially, Medicare is always going to look 2 years back to determine your Part B premium. Now, for the Medicare supplement plan, that additional policy, right, the G plan or the N plan, that is based on your current age, gender, and your residential location, right, where you live. So the Medicare supplement actually doesn't have anything to do with income. That's Part B. The additional piece of insurance, the Medicare supplement, that is based on your current age, gender, right, male, female, and your residential location. And that goes up every year as well with medical inflation and some other factors. You might pick a Medicare supplement right when you go on to Medicare. That's $180 a month in addition to your Part B premium, right? But then that Medicare supplement will go up every year, a little bit for your age, but also what's going on in the world. We unfortunately across the board with Medicare supplements this year are seeing double-digit rate increases, 10, 15, 20% with just the medical inflation as it is and just a lot of things going on. So the Medicare supplement does go up in cost every year as well. Hopefully that helps answer that.
Yes, that's real helpful. And then I just wondered, do you have to go on at 70 if you continue working, or is there any outside
Yeah, great
age
question. Yeah, so at 70, you'll want to, you'll want to start considering your Social Security retirement benefits, right? Because they'll stop growing. And when you take your Social Security benefits, you don't have to take your Social Security retirement benefits, but it just makes sense to. But at that point, at 70 years old, right, when you start taking your Social Security, you will be automatically enrolled in Part A of Medicare. If you're contributing to an HSA, you'll have to stop that individual contribution to your HSA. You don't have to go on to you could stay on employer insurance if it's credible employer insurance. You could stay on that plan for the rest of your life if you work, for the rest of your life. I enrolled a gal that owned a very successful business, and her kids and their kids were also in the business, and they said, hey mom and hey grandma, you're 90 years old at this point, and you're costing our health insurance an arm and a leg. So I think it's time for you to go on to Medicare. We hate to do it, but we're not getting the renewals at work that we want to see with somebody that's 90 years on our plan, 90 years old. So I helped her. She got off the employer plan at 90 and went on to Medicare. No problems. So you don't have to go on to Medicare at any point as long as you have credible health insurance at work.
All right. Thanks very much. Appreciate it.
You bet.
So I was unclear about the Part D for the drugs prescriptions. So does that automatically start when A and B does, or is there another fee for that? And do you have to have do you need supplemental insurance for Part D as well?
Okay, great question. So the very first step in the process is you have to get Medicare A and B, and that's all you're applying for. When you go get a supplement coverage and a drug plan, those are two separate pieces and additional pieces of insurance that you apply for separately, right? So it's kind of a multi-step process. Step one is you have to go get Medicare A and B and apply for that online through your Social Security account. Once that application just for Part A and Part B has been processed, then what we would do is get back with you for another meeting, and we would pick out your supplement and do an application for that. And we'd pick out your drug plan and do an application for that. Now, with the supplement plan, there is an additional monthly premium that you have to pay. And it's highly, highly recommended that you get one because it covers the 20% unlimited, uncapped that Medicare A and B does not cover. Your drug plan is optional, but I'm going to make a valid argument that even if you're not on any medications, you should still have drug coverage. In most parts of the country this year, there's anywhere from 10 to 15 drug plans offered. So it's not just, hey, I'm going to go enroll in Part D and in one size fits all. No, when you choose to get a drug plan, you actually are evaluating, and I can help you with this, but we're evaluating between 10 different drug plans, from Cigna to Aetna to United Healthcare. And really the system, the software and technology that I have in place, I plug your specific medications in. Atorvastatin, 20 milligrams, right? Lisinopril, 10 milligrams. And my system and software will come back and say, hey, here's all the different drug plans in order. Here's the best plan for that person. And some of the drug plans are going to charge, most of them will charge a premium just to have the drug plan, right? Even if you're not on any medications, they will charge an additional cost. And then when you go to the pharmacy, you also have to pay when you pick up those medications. Now, those two medications, atorvastatin and lisinopril, they don't cost anything. But most medications will have some sort of copay, maybe $5, $10, $40. And so, yes, with Part D, you pick the plan, there is potentially a monthly premium, and you have copays at the pharmacy. And yes, you would get two pieces, a supplement coverage, and you would get a drug plan. And that's really if you go with option number 1, which is the left side of that flow chart, original Medicare.
And do those have to be with the same provider? So would they, for instance, have to both be with United Healthcare?
Really good question. The answer is no. And I would tell you 80% of the time, 90% of the time, maybe I use completely separate providers, right? We might have United Healthcare for their supplement, but Blue Cross or WellCare or Cigna for their drug plan. So no, they do not. And there's no benefit to having your supplement with United and your drug plan with United. They don't give you additional money or discounts for doing that.
Great, thank you.
Absolutely.
I had a quick question. I've seen some stories where when you're on a Medicare Advantage program, being that it's traditional insurance and all their faults, that there's a lot of denial of care and lengthy processes to appeal. Have you seen much of that experience?
Yeah. And I tell you that's, without specifically saying that is really what I mean when I say managed healthcare. Pre-authorizations and pre-approvals, right? That's exactly what I mean. And that's kind of a distinct differentiating factor from the Advantage plan compared to original Medicare and a supplement, is that those are some things that you can run into. Now, if you go out to the insurance provider's website, they say they approve 98% of all claims within 24 hours. And they've got all these published numbers that make it seem like, they never deny claims, but certainly I would tell you that is one of maybe the things to consider. Absolutely. If you go with an Advantage plan, is that the insurance company has a seat at the table with you and your doctor, right? Making those decisions and helping you plan out a path forward versus original Medicare and a supplement. Your doctor says, here's what we're going to do, and they're going to do it.
Okay, well, wonderful questions, everybody. We're about 10 minutes past the hour, so I think we're going to wrap this up. But if you do want a copy, I think, Lauren, are we going to be offering a copy of the presentation afterwards?
Yes, that will be sent out in our newsletter as well as the recording once that is approved by our compliance department.
Okay, wonderful. Well, Grant, thank you very much. All great information. I know there's a lot of complications that come with it, but again, for those of you that need help, please seek guidance from us. We are here to help. And everybody have a wonderful weekend.